So, Dr. Crisp.
Yes, sir.
Research Friday today.
Yeah.
But without research.
Okay, so hold on a second. Research Friday, but without research. So it's just Friday.
Just Friday.
All right, man.
So here's the interesting thing. Change of pace a little bit today.
I like it.
But
Okay.
with a purpose.
Like it.
So I know a few weeks back we had done a video on reviewing compartment syndrome in the lower leg.
Yes, we did.
And had some great responses and feedback on those articles or that reference being able to help somebody with their patients.
Yep.
But interesting thing is just the other day I got called in on a case, and I think you had happened to actually look at the case a while back too, from one of the esteemed docs we work with. And in this case, the patient had come to us with a previous MRI done and was thought to have like a tear within the gastroc or possible compartment syndrome.
Okay.
So they had the MRI done of the lower leg. Inconclusive. Within normal limits.
Within
no findings.
everything's fine, right?
Yeah. Patient would feel better post-conservative care.
Okay.
But the interesting thing about the patient was after walking 10, 15 minutes, pain would come right back. And he'd have to stop walking. When he sat down, it would sometimes go away.
Okay.
So when you start thinking that, what do you think of?
I start thinking vascular. I start thinking some type of tear. Maybe not where the MRI went because, you know, because we know MRIs stop at a certain spot. And I've had multiple patients that the problem was right there.
Yeah. I mean, I even thought this might be one of those random cases of popliteal artery occlusion.
Absolutely. Or
same presentation.
Yeah, absolutely. Or they could have like a disc tear in the back, a meniscus tear.
Yeah.
They could have, you know, you could have some type of cyst involvement. You could have Baker's cyst. You could have a lot of things going on.
Yeah, and you know, props to this doc. He did a phenomenal job at managing the case. Didn't respond well to conservative care, so he didn't waste the patient's time or money.
Yep.
He sat down, had a second opinion, and decided, you know what, I think we need to do a new image because we actually had the patient bring in the MRI and took a look at the original MRI.
Yep.
And like you said, it stopped almost at just south of the tibial plateau.
Well,
so it did a great job looking at gastrocs. Did a great job
looking at gastrocs, but what about
it didn't have the knee?
Where gastroc attaches into the femur and
so the patient.
Okay.
So doc sent him out for a new MRI of the knee. Comes back a popliteal tear.
Ooh.
Which is in essence a posterior horn tear.
Yeah, absolutely.
And a cyst in the back of the knee. So now this patient was managed correctly.
Absolutely.
Gets to go into a ortho visit.
Gets to go to the ortho visit, which is appropriate. They're going to be able to fix the cyst, drain the cyst, and or do a surgical procedure and fix that meniscus, and the patient's going to be better.
Patient's going to be ecstatic. Doc did a phenomenal job. It worked out well. And so what we want to do today is we want to invite you, our esteemed audience.
Absolutely.
If you have any questions, if you have any cases that you'd like to discuss, or even hear something about in terms of a lit review or an assessment or a rehab, please hop down to that comment section, shoot us a question or a comment, and we'd be more than happy to discuss it in the upcoming video.
Absolutely, and since I'm one of the HIPAA people, just keep it as clean as you can, no patient info, and then we'll just go from there.
Yeah, we're looking for topics, not patients' names or identifications.
No way.
We want to be able to help all of us understand how we can better manage some of these things.
Absolutely, because that's what we're here about.
Yeah, we look forward to your comments.
Yes.
We get excited about those and those questions that we have. Together, we'll be able to help patients. I'm Dr. Moll.
I'm Dr. Crisp.
And we look forward to seeing you next Friday.
Next Friday.